finding out that the epidural is a tube that stays in your back the entire labor.
Hey guys, I'm a labor and delivery nurse, and this is so true. A lot of people don't know that the epidural is like a thin tube, same as the IV. So when you get an IV inserted in your hand, it's a thin tube that stays in the vein. And it's the same with the epidural. It stays in your epidural space, which you can see right here. And then the actual procedure is just inserting that tube, and they use that needle that you can see here to insert the tube, or the catheter we call it. And then once they've inserted the catheter, we tape it all in place, we lie you flat on your back, and then that's when they'll give you the actual medication that goes through the tube, and it continues to give you medication all the way until baby is coming out and has been delivered. And then you can actually just turn off the epidural infusion. And I usually keep it in my patient's back for about an hour postpartum, just to make sure everything goes well and they don't need to, for example, go back for emergency surgery. Because if that's the case, they can actually use the epidural and give more medication. So I keep it in the back, and then after about that hour postpartum, I take it out, and it's a quick, easy takeout. You won't even feel it. The worst part about taking out the epidural is actually just the tape that we use, because you get a bit of a back wax. But yeah, it's just a little tube. You won't even feel it in your back. And then we just make sure we secure it in place, and it just continuously gives you medication. Same thing with the IV. It continuously gives you fluids or medication through that little port in your vein.